Hi, it's Jill here. Just some thoughts while I drive around the countryside. I've been delivering leaflets today, and I wanted to tell you about something that happened to me and my team a couple of weeks ago. We did an event and did a number of lifestyle analysis on local people, and it was a really interesting experience. We met some lovely, lovely people. But we noticed some trends that I wanted to share with you, just to see whether or not you think they're as interesting as I do. It seemed to us that the people that were the healthiest and that had the best results were the older generation in their 60s and 70s. And that as we got younger and younger, the results tended to get worse and worse. And in fact, we did a couple of 16-year-olds and their results were really, really poor. And what was also interesting was that we had a percentage of people that sadly are either suffering with cancer or recovering cancer sufferers, but their results were by far the best, and some of the best results that I've ever seen, actually. And it was really interesting. It was across the board virtually how the older generation, we can only think it's because when they were born and when they were brought up 70 years ago, is that they had access to really good quality food. In those days, you know, they ate in season, almost everything was organic then, and the soil quality was then much, much better, probably 50% more mineral quality now than it has in this day and age. The people with cancer clearly were being very, very proactive about their health. They'd cut out all the sugar from their diet. They were making sure that their diet was pH balanced because an acidic environment feeds on cancer as does sugar. They were eating really clean, drinking plenty of water, doing all of the things that we should all be doing all the time. And it was really striking how their results were absolutely fabulous. And that included their nervous system as well. They were actually dealing with the issues that they'd got. And then we had several ladies, sadly, who were suffering really badly with maintaining their weight and struggling with their weight. And everyone to a T had been at some point or another on repeated, actually usually, calorie controlled diets or low fat diets. And every time they'd lost weight, they'd put it back on again. So we are really looking forward to working with some of these people and educating the ladies to get them to understand that this is not their fault, that there is a really straightforward way of dealing with weight issues. I learned to do this a couple of years ago. I learned that, you know, healthy eating and making sure that you have protein at every meal is really, really important, and that you need to eat in order to lose weight, and you need essential fatty acids to lose weight. So we're going to work with some of those people. We're really looking forward to helping some people out with some dietary advice and getting them on some proper support and supplementation that is going to give them the opportunity to have optimum health and to stay well into their 70s and 80s, which is, you know, in fairness, what we want to do. So, okay, I'll speak to you soon.